It is with great pleasure that Dr. Jody Madeira and myself will be presenting our paper entitled Improving Informed Consent Using Multimedia Platforms in this month's Fertility Sterility. Informed consent within the context of assisted reproductive technology poses unique ethical, medical, and legal challenges. Given that ART risks, benefits, side effects, and alternatives often bear little resemblance to those in other practice areas, such as multiple treatment options, establishing or relinquishing parental rights, procreative planning posthumously, and gamete or embryo disposition after dissolution of possible relationships. And with this, many reproductive endocrinologists, mental health care professionals, and attorneys have expressed concern over whether patients actually understand and properly can balance ART's risks, benefits, side effects, and alternatives. Furthermore, concern exists that patients may find the ART consent process overwhelming, undermining recall and comprehension. And even more challenging is that as informed consent documents have evolved to include more complex services and issues. These issues have prompted professionals to strategically simplify these documents, potentially changing its medical and legal efficacy for better or for worse. In other disciplines, medical practitioners have employed a variety of multimedia patient education and consent tools to improve patient comprehension, ranging from DVDs, narrated computer applications, and computer tutorials complete with quizzes. Previous studies have yielded equivocal results regarding their superiority to traditional paper consents.
Hi, I'm Dr. Jody Madeira. I'm a professor at the Indiana University Maurer School of Law in Bloomington, Indiana, and I'm first author on the study. In this study, we analyzed patient and provider feedback on how a multimedia platform, EngagedMD, helped patients to understand the risks and benefits of IVF and IUI treatment, and how it impacts the informed consent process. One reason why this research was so important is because there's not really much out there on how e-learning platforms and how multimedia platforms affect patient-provider relationships, affect retention of knowledge, and affect the care experience in general. The response of patients was overwhelmingly positive to this multimedia platform. In our data, which was based on a study of 6,333 fertility patients who viewed EngagedMD, we found that 93% strongly agreed or agreed that the platform was intuitive. 95% agreed or strongly agreed that the platform was of appropriate detail and length. 88% agreed or strongly agreed that the multimedia platform better prepared them for the consent process. And 83% agreed or strongly agreed that the multimedia platform increased their satisfaction with their care experience. Now, as we know, informed decision-making requires education, knowledge, counseling on risks, benefits, side effects, and alternatives, and also discussing the risks and benefits of each treatment option. In general, we found that multimedia platforms, such as EngagedMD, have very strong potential for making patients better informed and making informed consent processes more efficient. Thus, they have benefits for both patients, increased understanding, knowledge retention, and providers, efficiency, and just perhaps that opportunity to discuss matters with their patients that maybe require a little bit deeper discussion, digging down, like ethical questions, questions about values. So as the process of informed consent research evolves, as we get more and more technologies that help us to improve the informed consent process, future research must evaluate the impact of such platforms on patient recall, on patient comprehension, on doctor-provider relationships, and on the best timing for implementation.